When I went to nursing school, never in my wildest dreams did I expect there to be a pandemic like this. I finished nursing school around the time of the HIV/AIDS epidemic when it was first being discovered. So on some fronts, that was something that was very new and different and seemed very extreme. We had studied in school times of cholera. There was always other infectious disease outbreaks like the flu. We talked about, plagues and different things from history, but never had I expected something to be so widespread that was touching everyone in the country, everyone in the world was affected by a disease like this. So when you're in nursing school or when you're in your training, there's always times where you have mass casualty drills, or you have drills where you're preparing for some kind of surge event. I know in today's world, they do a lot of active shooter kind of drills, so where they may be preparing for a lot of gunshot victims. But even in those sorts of drills or those sorts of training, you're preparing for a lot of very sick people who are coming in, oftentimes going up to surgery, may need to be staying in the hospital for a short period of time and then going home. You're not preparing for all of your ICUs to be turned into COVID units. You're not preparing for the rest of your hospital to be shutting down all of the elective surgeries. So this is a very different sort of scenario than anything anyone has ever trained for. So nurses and caregivers, people who've worked in a hospital, have always known that they could become infected or become ill from caring for patients. There's always been that risk you run just from being in a hospital, that you could catch the flu, you could get an infection, you could have a needle stick and catch a bloodborne disease. So that risk has always been there. I think COVID brings it home more so because there isn't a cure. Young people, as well as older people and people with pre-existing conditions, are more susceptible to dying from this illness. So it probably makes it even more real that your job could make you sick. And yes, you could die from your job. And that has to be frightening to anyone who's working on the front lines.